Good morning, good afternoon, good evening, depending on where you are in the world. Welcome to episode number 73 of the Unboxing AI webinar series. Today, I have a different background. We are doing shameless self promotion for RSNA. So, if you are coming to RSNA, please drop by our booth, please book a slot, please reach out to us. We're having almost 15 talks and 8 workstations and a bunch of amazing things at our booth. And if you don't know where you are today, well, this is the Unboxing AI webinar series every Thursday, 11 a.m. Eastern Time, 8:30 p.m. India time. You will see either me or one of my wonderful colleagues, talking to one of our customers, partners, collaborators, etc. And if you don't know what CAPL is, well, we are your friendly neighborhood AI platform, connecting you to this world of fantastic solution developers such as Ashwin. So Ashwin, thank you so much for joining. I
Yeah,
can't believe we didn't do this sooner. But yes, for those of you who don't know, Ashwin is the founder and CEO of Aikenist. Uh, while we are vendor neutral, one of my favorite use cases is super resolution and scan acceleration. Since I used to run Mahajan imaging, the chain of imaging centers, so speeding up MRI and reducing MRI wait time is, I think, every radiology administrator's dream, and that's what Aikenist is working on. Ashwin himself is a serial entrepreneur with decades of experience in building imaging products and businesses. Of course, he started Aikenist with the vision of making imaging faster, affordable, and effective, and has developed core technologies that reduce scan time by up to 70%. It's a fast growing startup, uh, finding it very difficult to keep pace. And we were just talking that we can't find time to meet nowadays, so that means we are busy doing other things, which is a good thing. uh, Ashwin himself holds around 5 patents and several publications on the subject. He's done his master's in signal processing from the Indian Institute of Science and has worked on very, very cool technology at Motorola, NXP, and was earlier, in fact, spent almost 10 years building his previous startup, AlgoVision, which now has business in 30 plus countries. And I think everybody who's come to Delhi airport has probably used Ashwin's technology. So thank you, Ashwin, for being here today, and very, very excited uh,
yeah,
to hear from you.
yeah. Hi, Vidar. It's nice connected here. I'd love to share whatever we can do best. Yeah.
So Ashwin, first and foremost, what did AlgoVision do? Yeah, AI Chemist we'll talk, I'm sure, lots about, but what did AlgoVision do? Or what
Yeah.
does
So,
AlgoVision do?
yeah. So Algovision is into video analytics, the cameras that you out there, all the CCTV cameras, right?
Hmm.
So we analyze the videos there, like facial recognition, number plate recognition, and bunch of like.
You are the reason I get all those speeding challans.
No, not right. So, yeah. So yeah, those are the technologies is pretty useful there. Actually, you can get speeding channels also, so basically you put a camera and the camera senses video and you can do the same like AI analysis. That's what you can do with, and in fact, deep learning, the big application started in actually these videos. Okay. And surveillance videos, and that's still very, very big compared to even medical imaging. And it's one of the earliest what NVIDIA found a golden use cases for videos.
Wow. So today, if I go to, say, Delhi airport, like what does AlgoVision do? Like what is it that the use
So
case is?
we are in multiple airports and metros, like Mumbai Metro as well, and other airports as well. So what we actually have a facial recognition system. So most of the surveillance cameras put out there requires intelligence to track the people across, and that's kind of equipped with the advanced video analytic technologies, which can actually do detect people in the crowd.
Wow. So
Um,
it's like the Born ultimatum kind of scene.
yeah, it's
It's a,
getting there. It's getting there actually. Yeah, sorry, it's a lot of fantastic stuff happening there. Yeah.
nice. So Ashwin, why leave, the world of, video analytics for face recognition, etc., surveillance, and why jump into, like this extremely difficult, if I may say so, industry of healthcare? Like what happened that you thought that this was a good idea?
Yeah, we can think different things in the hindsight. But so what actually is always, I know I'm as fascinated by images. My right from my engineering, I started working on images and videos. I was part of the in Motorola. I was part of the team which developed early video recording on mobile phones. And then during that time, we used to actually do on QSAFE, low quality videos, right? And now you can see, I mean, anybody can shoot videos and HD quality, and they are superb. They're professional using just your mobile cameras. So the field has gone in multiple transitions during this phase. And when I was also working on the video analytics space, right? So I looked at that space, and there also it has gone transitions right from when we started with this very small things, which was very difficult to detect people. We need to have a straight pose and then detect the faces. But later it changed, okay, and we can do it in the crowd. And even for number plates, any kind of number plates, you can detect it. When I see the technology transitions like this, right, what changes is the progression from the early days with newer technologies that comes into the picture, like AI, right? And also on the hardware side. So the kind of technologies that happens to acquire this, signals better, all right? I actually looked at the problem. First, we started with early diagnosis of cancer. Okay, but then access to medical imaging itself is a bigger problem today. Okay, people don't go often when people asked to go for MR, they're really scared to go MR, right? So it's you cannot really, it's not a convenient process. Nobody loves it, but it's very essential. As we know, it's a golden standard for many things. So I mean, I have a completely external perspective, right? So and here I thought, what if we can make it really easy, right? Yeah, if it's made as very fast, right? So for example, the analogy, because I'm coming from the security background, right? So I analogy we give in airport security checks, you have
Yeah,
360-degree X-rays, right? So which is
yeah.
it scans your body for any weapons or anything. That kind of thing is not really inconvenient to people, right? So if you are going to make very convenient, to people, then it's people can undergo scanning. And the first thing that I got fascinated was with the MR. It's very safe. You can do any number of times. But it's 30 minutes, right? So it's a lot of time for people. So I think that's the problem that we took. Why can't we make
But
it easy?
Ashwin, tell me one thing. So, we'll certainly talk about AI Kinest in a second. But uh, if somebody comes to you today and says they want to start a company in the healthcare AI space, uh, what are two or three pieces of advice that you would give them?
See, I would actually urge people to come with a very fresh perspective, not from the, first understanding what it is currently, but what is the problem that people are facing, right? So that's the thing. And if you start with that, slate, right, the clean slate, then you see that healthcare has a lot of problems to solve, real good problems to solve. And then you think, start from the first principles and build your solutions, right? And then based on that, so even just as simple as, for example, somebody's health, right? Early diagnosis of cancer, like I will pick it up as a problem, which there are many methods, but imaging is also can be very potential very good method. Typically, we should have that as a part of the screening solutions for people. Okay, and they can actually get a multi types of cancer very early, right? So that's something very powerful for people, right? Coronary diseases. So if you are able to detect early.
You're saying basically you're saying like have a very powerful use case. And besides that, like what has been like the biggest surprise for you as you entered, this industry coming from the world of like hardcore video analytics, etc. What has been something that really, took you by surprise?
It's very deep. Okay, so here we are talking to clinicians, right? The clinicians are experts in their domain, and if you want to develop a solution here, I think first you need to develop expertise in understanding the
Hmm.
problem first. Okay, this the field really well first. Okay, so for us, though I've been an entrepreneur, serial entrepreneur, it took me quite a while to understand the problem because I will not be comfortable if I don't understand the field really well. So when we speak to doctors, we should actually talk at the same wavelength as them. Okay, and and that is where I think it takes time here, healthcare, right? So it's quite, it's very deep and there is no shortcuts here. You probably actually can develop AI solutions in video much easier than here. Okay, and it's a long process, much longer process than the other.
And now, Ashwin, like, Elon Musk had a few months ago said that use Grok to get your X-rays analyzed and CTs analyzed. And, I know that there's a lot of people who are copy pasting, their images into Chat GPT and asking Chat GPT to, uh, you know, give answers. What is your take on that? Like, do you think, while, today, of course, we agree that, they may not be um, at a clinical level, uh, putting on your technical hat for 1 second, do you think these large language models, the visual large language models, can actually do as good a job as, say, deep learning models trained on millions of scans?
See, I mean, first of all, as we are, we know that in medical there are quite even for actually analyzing a MR or CT scans, we look for many things there, right? And it's not like very clearly defined things. So there may be 50 or odd more diseases we have to find it with a single scan in right trying to find different possibilities. So if you want to solve actually trying to detect the way the radiologists today detect the diseases to a level that they do, I think that is still far away, right? But what Silicon Valley companies are good at is rapid consumerization of the tech. Okay,
Hmm.
they actually tear down the gap that is there for utilizing such things, right? So anybody can make it very easily use it, and over time I think they become better at it. Okay, so I would say these companies will definitely drive rapid consumerization of these kind of technologies.
And what about the regulatory angle?
See, I used to actually see this, like, when we come from industry perspective, right? I was working in Motorola, for example. Um, Everything was like privacy was a very difficult, thing to crack when we actually working at, Motorola, because we were always thinking that what if we build these certain technologies like that time Facebook, what kind of privacy concerns people have, right? But then Facebook did it. I mean, they and then similarly Google has all the data of the world, and nobody can actually right now. So the way they solve the problem is that once you consumerize, once people depend on it, okay, then they flip the problem to the consumer side, okay, and then it's affecting a lot of people, it's benefiting a lot of people. So then there will be a different type of thing that comes into picture.
Interesting. And in terms of like, and also for everybody who has joined, please feel free to ask your questions. The whole reason we do this as a webinar and not a podcast is so that we can get all of your questions here. Uh, so Ashwin, just putting on looking at AI Canist technology, uh, one is of course the whole MRI acceleration piece where you can say reduce the time taken to do an MRI by 70% because you can take a, if I may put it like, you can take a bad image and make it a good image using AI. But I also know that you have done a lot of solutioning around that solution. So can you tell us a little bit about that journey, like how you went from being, pure play model developer to now more of a platform in that sense?
Yeah, that's a good question. See, when we started with the problem, actually accelerating MR, right? So we have developed the model right from the scratch, training on a lot of things and for super resolution and denoising. Um, and during that time, we found that when we talked to radiologists and in radiology centers, mainly the scanning is one part of the problem where we want to actually make people convenient. So even after doing that, still people have to actually first whether there are multiple problems here, right? So first, even scheduling, whether patient requires a scanning or not. That itself is $1 million question because people try to actually use their own way of actually recommending them after ruling out many things, mainly because of cost and time criteria, right? So that is first thing that we want to solve, right? So we cut down that time. If person needs like scanning, we should be able to tell you need scanning now, right now, okay? And that is first problem, that another problem that we are trying to solve. And then second is the scanning, where we want to reduce the scanning time. And the third is the reporting time, right? So once actually you have a lot of scans, then what next? Are the radiologists have enough time to report it for the entire thing, right? So that's another problem where we want to cut down the radiologist time, right? And so that is what again we worked on the problem. I know how to actually fasten the reporting time, cutting down that as well, and the workflow. So in the entire process, there has to be allocation to radiologists, and radiologists to open the viewer, view the scans, and so there has to be a lot more automated stuff there, the entire process. Okay, and that is what actually we actually also bring in. For example, oncology, they have to look at cases several months and even for several years, and it has to be presented in a manner that they really able to compare very well across, right? So that is something is today is still a challenging problem, and those are the things that we are trying to solve to make everything process very simple.
No, and on that point, we have a couple of questions come in. First one is by Ananya, who asks, you mentioned consumerism. Do you think that radiologists may come to have a over reliance on AI if it is implemented? So your thoughts on, over reliance on AI?
So what do you think? I mean, you must have seen the recent evidence. Even I was like surprised to see the radiologists are opening the chat GPT, generating actually the first cut report, saying that I have found this and generate me a report, right? So those kind of technology dependence, even for the experienced ones, are there now. And what about the fresh ones, right? So that is bound to happen. And the technology is always like that. People actually it solves the lower, I would say always the lower order problems to make what considered the higher order problems a lower order problem, and much higher order problems which you have not imagined to become a problem that you want to actually are expert at it.
I 100% agree. It's like, are we over reliant on GPS? Are we, there was a time we would all remember the phone numbers of people, and we would dial using landline. Now, we don't. So is that also a bad thing? And I think uh, the nature of learning will change, right? The nature of what it means to say diagnose a stroke or diagnose a spine MRI or etc. Once machines become really really good at one thing, like humans should
Yeah, go graduate to the
figure out
next
how to
level.
use it.
Yes, yes, yes. I mean,
So
in healthcare, you can solve problems next 20, 30 years. Still, you would not have solved every problem. Okay. So I would say that that is the one you should really worry about. Like, are we solving those problems now? Okay. As I was telling early diagnosis, I still go back to that. Still, it's a very difficult problem to solve. Is that problem going to become easier because of AI? That's what we need to think
yeah,
about.
correct, correct. No, let's move on. Many questions coming in, Ashwin. This is great. Next is from Dr. Suresh Mukherjee. Thank you so much, Suresh, for joining. Suresh is one of the world's leading neuroradiologists, and I think the only person in the world to have listened to every unboxing AI
I know I saw I heard his podcast as well. Yeah, it was good.
Right. So Suresh asks, do you envision a day when a patient will have access to multi-point AI algorithms, can take their own image files, generate their own report, and show this to their radiologist? Somehow similar to how Fidelity, the financial company, provides us different analytics for finance management. So, do you think that day will ever come, Ashwin?
See, I can only just second guess here. I'm not a very good expert in everything, but what I foresee is that people will have access to a lot more information than before. And that is really going to help in a way because they are much more informed. You tell today, ask anybody what is CT or difference between CT and MR, they really don't know. Okay. So when the education is so low about even the difference between what is X-ray, CT, and MR, and they don't know what is the benefit that they are going to get from such technologies, right? The more they become aware of what it is, the more they are going to use it. Okay, and they're going to adopt it. So that is what I feel that is what it will happen, because once they started understanding themselves, like what it indicates and what it is capable to do, they probably use more of that technology. And of course, medical practitioners, you can never, I think, that is inevitable. They have to, I mean, they have to be there in there as a part of the whole process. Okay. Human in the loop is must. I have not seen any technology completely coming out of it as in the regulatory becomes very, very important, right? So that should be there for long.
But I think, it's interesting. It's similar to how 10, 15 years ago, when Google was just coming in in medicine in the form of, patients first Googling their symptoms and then going to the doctor and telling the doctor that I know I have this illness, give me the treatment. And then, of course, one had to uh, go deeper and explain. But I think here, on top of search, there is intelligence, right? And there is intelligence that is getting exponentially better every 6 months. So it'll be very interesting, and I do feel that humble doctors who admit that AI is a partner of theirs in their patient's care journey will, in fact, do much better, yeah, than those who try to go against it. But of course, time will tell. Ananya has asked another question. When you say it's good to cut time, do you believe that AI should be delivering news to patients, or should that still be the role of a physician? I guess, delivering news in terms of like you have this illness or that illness, like should that be done by AI or should it be done by the physician?
I think that has to be done by a physician, definitely, right? However, you actually technology says something, especially when it comes to like very important things like healthcare, right? Um, it has to be. It's a human mechanism. You need to get something from the others, saying who are experts in this, um, and probably get their opinion, right? So about it. I think that will not go away at all. Okay, we still go to the doctors and get this, opinion from them.
Yeah, I think, I don't know. Sometimes I feel, Ashwin, good news might be given by AI and bad news maybe by human. Because the number of patients increase at such a fast rate that delivering all news may be a challenge, but we'll see how that pans out. Next is a question from Wasim Uddin. Wasim asks, how will be the career of radiologists and its scope in the future. Those who are good in AI and envision to make some AI models and companies. And how should one bridge the gap between being a software engineer and a doctor?
I mean, of course, this is, I'm not a radiologist again, and
Basically, I think if I was to summarize the question, it's like if I am a radiologist and I want to build an AI company,
mm.
what is the scope for me?
Yeah, so I think since radiologists today, they have immense knowledge about everything, right? So they look at how you can adapt to the patients who know AI. Okay, not just they know AI, and they also adapt to the patients who know AI. Okay, because you need to treat a person who comes with some experience or some knowledge on that as one of the challenging times where you can have a good conversation with them, okay, rather than somebody who doesn't know anything, and that will elevate the knowledge as well, right? So to further understanding and a better thinking on these prospects, I think radiologists should look at that, adopting how we actually uh, make, once the people awareness increases on these fronts, what more problems we can solve for them, okay,
Correct,
using.
correct. I think it is whether you are a radiologist or a software engineer or both or neither, you need to be solving a problem, right? We'll quickly go through, a few more questions that have come in. One is two questions from someone who does not want to be named. The first is, what advice would you give to a hospital CIO evaluating AI for diagnostic imaging?
Yeah, so I mean, this is definitely a very transition period, right? So there are a lot of things are changing, and in fact, today so much is changing, and the best ways as years to adopt is to visit conferences like RSNA and get a lot of knowledge. First of all, how the things are shaping up in this field, um, and we every day we have big Nvidia news or something like that. AI is everywhere, right? But to get real dipstick understanding of these things, it's better to attend some of these things, look at the technologies that are maturing, understand in depth about that, and then go back, and because they are the best guys to implement it,
Yeah.
those solutions, right? So then go back and work out certain workable solutions for themselves.
Good, got it. So basically, go out, explore, and then try. Next is from Dr. Swapnil Patil. He asks, what are the biggest challenges you face in generalizing AI models across different MR scanners? Very technical question.
Yeah, so that's a very
I am assuming this is Dr. Swapnil Patil, I think from Mumbai, if I'm not wrong.
okay.
Yes.
The generalization is quite tough for MR, as long as as far as MR is concerned. There are things like segmentation can be done much better way, but of course there are different contrast scans that we take it, and each one actually comes with its own challenges. What we have seen it, so uh, it's a very the MR is the last modality that we can see that many problems can be solved. Uh, we probably can do that first, X-ray and then CT, and finally, I mean, MR, and then the most toughest I see is the PET CT. So it will go in that order, actually.
So it is a big challenge. Next is, how has AI Chemist tackled the challenges of deployment across various healthcare environments and geographies?
So again, we actually work with players like you to deploy and multiple places. And the first adopters are the ones who are very knowledgeable people, and they knows, like merits and demerits of any of these things very well. And they actually we work with the partners who take it to them, and they evaluate, they do the validation initially, and if they're okay with it, they actually start rolling out the products.
Nice. And last question, after which we will close, is from Shrikant A. He asks, radiology reporting today still relies heavily on qualitative language such as mild, moderate, severe, which are inherently subjective. With AI now capable of precise quantitative analysis through volumetric measurements and radiomic biomarkers, do you believe the future of radiology lies in replacing descriptive interpretation with objective data driven quantification? And if so, how does that redefine the radiologist's clinical judgment and communication with referring physicians? So, is radiology going to be quantitative? And if yes, how does that change the radiologist's report?
A fantastic question. I think what I have seen is firmly, one sentence answer is yes. Definitely, from the descriptive to a much more, basically quantitative information
Objective, yes.
that comes out of these technologies, and in fact, that feeds a lot more information to radiologists and data comparison across as well. And this is inevitable for radiology to progress to the next level. Today, what we see is definitely there is no, we can't compare over like several scans and across different patients and for the same patient over time. So, and if you want to do that, these are the quantitative measurements will actually bring big change in the radiology.
Yes, and agreed wholeheartedly. And now the actual last question from Johan. Johan is a good friend out of Europe. In my opinion, your biggest competition comes from MR OEM companies. For example, Compress Sense from Philips. How do you position yourself in relation to these technologies? I think GE has Air, Philips has Compress Sense, etc.
That's a very good question. So the way I see it is that, MR, we have magnet coils, which doesn't change much. The post-processing technology keeps changing every 2 years or 3 years, a newer technology comes. So there is always a space for post-processing for this kind of things to improve the quality, because the replacement cycle of MR is 7 or more, but the replacement cycle for this kind of softwares can be even faster, right? And there are more things that are coming up. And what we see is that both can coexist. You probably, when you buy a new machine, you'll get the latest technology at that time, but you want to upgrade it in regularly, then you'll have to buy.
I will help you, Ashwin. The one line answer is cost and faster upgrades, right? And cheaper upgrades. I think there is no denying, like yours is an OpEx cost. Those are generally very heavy CapEx costs requiring hardware, requiring multi-year kind of upgrades. Whereas here, you flick a switch and you have a new model. So with that, we'll end. I know we'll end very abruptly, but thank you so much, everyone, for joining. One of the most engaging sessions ever, I think, in terms of number of questions. And thank you, Ashwin, for being here. Next week, we will see you same place, same time. We'll have Dr. Pavan Sinha from MIT, one of the world's foremost neuroscientists, on the webinar. So that should be exciting. But thank you, Ashwin. Means a lot. Thank you.
Thanks. Thank you.
See
Thank
you in
you.
Chicago.
Yeah, see you.
Bye.
Thanks, guys. Have a nice day. Bye.